Good morning. Costrochondritis. What is it? I'm going to be talking about what it is and how the symptoms can affect you, and basically just a bit of information about it. So, Costrochondritis is inflammation of the cartilage in the rib cage. It's that straightforward. The costro part of the name comes from means rib. The chondro means cartilage, and the itis at the end means inflammation. Now, with certain types of inflammation in certain places in your body, it can cause severe amounts of pain. Within this area, and sort of the rib cage surrounding your whole body, the costochondritis can really cause a lot of pain. And it means that movement is very, it can mean limited, but it's very painful. So you can imagine, as you move your body, whether you move your body, sideways, side to side, forward, backwards, twisting in any way, your rib cage should move and your sternum should help you move and adapt with your general movement. Now, of course, the flexibility is there, like any other joint around your body, to make it easier to actually move. But of course, that flexibility is also hindered from a pain level. So you would hit pain quite quickly when you move a certain way, or if you've got severe costochondritis, you might be in constant pain and struggling with any kind of pain relief. Now, one of the things that I've learned over the years is a type of like a breathing method to help keep the pain at bay. Now, I have ankylosing spondylitis, so I have systemic inflammation around my body. It basically, moves around effectively. It can be anywhere. One of the areas that I do get it quite often is right here, and that is effectively costochondritis. It's inflammation of the sternum, the cartilage of the sternum. And one thing that I was I was shown by a physio a long, long time ago, and that was a simple technique whereby you have costochondritis and you go, let all your breath out first of all, then take a deep breath in and fill up your lungs to quite a level, but not full, and hold it there for a little bit, and then you can gasp in just a little bit more, like that. Hold it for 3 seconds. That is in itself is going to be painful. Okay, and disclaimer: I'm not a physio, I'm not a doctor or anything like that, but I have found this works for me. So once you've held that breath in, hold it for 3 seconds. 1, 2, 3, and then let it out gently. Okay, and you can do this up to about 3 times, but be very, very careful. If you feel lightheaded or anything like that, don't do it. It's best to do it, in a safe place and where someone can, help you if necessary. So what happens is with that is it's kind of, it's almost like an exercise or a stretch itself, where you're helping your rib cage kind of just expand and contract a little bit more than it would normally through breathing. And like anything, motion is lotion. It should help with at least bringing down the severity of pain. I use this probably when I get costochondritis, say, you know, I get it first thing in the morning, I'll probably do that exercise probably once an hour for the day until it subsides. And that's that's the only way that I see that that I can get rid of it, through natural stretching. There are medications like NSAIDs that you can have if you've got an acute like a bout of this, and NSAIDs can help in terms of just bringing down that inflammation, but of course they won't get to the root cause. So it's quite nasty. It can come from all sorts of things like injuries, you know, like a broken rib. You can then get it, you know, further down the line, like years after you've broken a rib, from things like scar tissue and stuff like that around that area, because it is quite a sensitive area, let's face it. And other things like if you've got a sort of an arthritic condition or an inflammatory condition, things like that. So I have ankylosing spondylitis, which is an inflammatory arthritic condition, and so that causes problems with inflammation here, and yeah, it's not very nice. So I thought I'd just do this video to help out anybody that's kind of suffering from it. It is, you know, like costochondritis is the full word for chest pain, I guess, you know, from a rib cage perspective, not chest pain within your chest. Obviously, if you think it's from inside and you need to go to GP, you know, I don't want to be saying that it's just rib cage when it could be heart problems or anything like that. But this is how you would help with actual costochondritis. Okay, so I hope that has been helpful for you. And here's a lovely picture in the background. I don't do many pictures in the backgrounds of my videos. Might start doing them. Makes it a little bit nicer to watch. Yes. Okay, so until next time, bye-bye.